Prediabetes is a wake-up call that alerts you that your blood sugar has crossed the line of normality, requiring you to take some action, or it will lead to full diabetes. Diabetes is a disease that causes the body to not be able to make enough insulin. This lack of insulin then makes the glucose levels above what's considered normal. Diabetes is a progressive disease that can cause many complications if it's not adequately managed. However, long before full-blown diabetes manifests, there is a period of time where type 2 diabetes can be prevented. During the stage where there's a higher risk of prediabetes, by being proactive with your health, you can stop it dead in its tracks. To understand prediabetes, then we must ask, who is at risk for prediabetes? While it is possible that prediabetes can happen to anyone, there are several risk factors that one needs to have that can raise the threshold of the level of risk. Learning these risks enables one to take steps to eliminate as many of these factors as possible. One of the most common risk factors for developing prediabetes is carrying a lot of weight, specifically around the abdomen belly fat. Women with waist size of 35 inches or greater have a high risk level of prediabetes. Men who have abdomens that are 40 inches or greater are at a higher risk. The heavier that a person is, the more fat that person will carry. Carrying excess fat makes it more difficult for the cells to use insulin the proper way. When this happens, you enter a stage called insulin resistance, because the cells are resisting insulin uptake from the blood. This stage causes the blood sugar levels to increase. Lack of some form of regular exercise is also a common factor in developing prediabetes. A sedentary lifestyle can lead to making your cells insulin resistant. This is what makes exercise one of the top to-do items that can help prevent prediabetes from happening. Regular activity helps to maintain a healthier body weight, in addition to helping the body burn glucose. In these ways, exercise helps the body not to be insulin resistant. Prediabetes can happen to anyone, at any time. But one of the big risk factors is getting older. Once you hit middle age, your risk factor goes up. Some studies point to the possibility that this risk increases simply because people tend to be less focused on maintaining a healthy lifestyle. When it comes to prediabetes, you can't escape how your genetics play into it. If there's a family history of diabetes, then your risk of developing prediabetes is significantly higher than people with no history of diabetes. There are certain life issues peculiar to women that can arise that can also raise the risk level. Women who had gestational diabetes and their glucose levels went back to the normal range after the pregnancy ended are at a higher risk of getting diagnosed with prediabetes later in life. Another issue, polycystic ovary syndrome (PCOS). This condition causes the estrogen and progesterone levels to become out of balance. The condition is linked with weight gain, obesity, and diabetes, raising the risk of prediabetes. This may be a surprise for some to learn, but having trouble sleeping has also been linked to prediabetes. When you don't get the right amount of sleep, it can cause your cells to develop insulin resistance. It's the insulin resistance that causes the prediabetes to happen. Those at risk include people who struggle with insomnia, those who work night shifts, third shifts, or whose sleep is often interrupted.